You're listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey coming to you from our RazorCast studios in New York City, where we are dedicated to bringing you top-quality advice from many of the leading expert professionals across the U.S. In today's episode, we are speaking with Dr. Igor Kaplansky. Dr. Kaplansky is the founder of Dentistry by Dr. Kaplansky in Gasport, New York. He grew up in Russia, and after receiving his dental degree, he was accepted into the International Dentist Program at the University at Buffalo School of Dental Medicine. He graduated cum laude in 1998 with a Doctor of Dental Surgery degree and continued as a resident in the Advanced General Dentistry Program at Buffalo. Since 1999, Dr. Kaplansky has been practicing family dentistry with a special interest in orthodontics and dental implants. He has been recognized with prestigious fellowship awards from the Academy of General Dentistry and the International Congress of Oral Implantologists. Dr. Kaplansky is widely considered to be one of the top dentists in the country, and he is also a contributing member of our National Network of Industry Professionals. Today we're going to talk about a very important topic, root canal treatment. Hi, Dr. Kaplansky. How are you today?
Hi, Liz. I'm doing well, thank you.
Great. So, what is a root canal, and why might people need one?
A root canal treatment, which would be the full name of it, is a cleaning and disinfection of a canal that is located inside a root of a tooth. Unfortunately, a lot of people have a bunch of misconceptions about this procedure, and they think that when we do a root canal treatment, we pull the root out or we pull the tooth out. We don't do any of that. So just do a brief overview of human anatomy. Each tooth has a root. Root is a hard structure that holds your tooth in the jaw. Inside that root, there's a small little space called root canal. And the root canal harbors, in a healthy tooth, it harbors nerves, blood vessels, and some connective tissue. When the root canal, or the tissue inside the root canal, gets sick, whether due to a cavity or trauma, and it dies in the end, what happens is it gets infected. When it gets infected, infection then travels into your jaw, and it can cause an abscess. So the second part of the question is, why might people need a root canal, is basically exactly that. The root canal may be necessary if a cavity reached the root canal and infected the nerve. If trauma led to the nerve death, then the root canal treatment would be indicated. It's a great way to save a tooth and extend the life of a tooth for many more years.
So root canal treatments have a bad reputation for being painful. Can you please describe the procedure that someone can expect when undergoing a root canal treatment?
Sure. The bad reputation comes, in my opinion, from two sources. One is early in the development of a root canal treatment, which was back in the 40s and 50s. Obviously, the technology wasn't so great yet, and the procedures were not maybe as comfortable. So, unfortunately, a lot of it stems from back in the day and how they did the procedure back then. And then the second part of it is, most of the time, since we don't do root canal treatments on healthy teeth, people come in with already a swelling, an abscess, or pain, and then it gets kind of etched in their brain and it gets associated with that. So that's why root canal treatments get a bad reputation. But in reality, it is really not any different than any other dental procedure that we do. The patient gets anesthetized, the tooth is numb, and anything that we do is comfortable and painless. Now, as far as steps involved in performing a root canal treatment, it's very simple. We make a small opening on top of the tooth into the pulp chamber, or where the pulp is, or into the root canal. And then we clean it out We remove all the infected debris and bacteria from there. We disinfect the canal with special medicines. We use different medications to disinfect and cleanse the canals. And then we seal it. We place a filling material into the canal so that bacteria and their byproducts are not harbored in there anymore. After that, the tooth is restored and it becomes a functional tooth again.
And what advanced technology and techniques do you utilize during a root canal treatment?
Like I said, since the 40s and 50s when they started doing root canals, the procedure has changed dramatically. Not only it's very comfortable, it's extremely safe and very fast, actually. It used to be that root canal treatments were done in multiple visits. People would come for 1, 2, 3, or 4 visits to do a root canal treatment. Now, probably 99% of them are done in one visit. So after patient is anesthetized, we measure the nerve or the pulp canal length with an electronic apex locator. That's one of the advances, one of the technological marvels, so to speak, that we use, which is a great way, very precise. It shows us accurately where the root tip is without taking x-rays. Another technological advance is a nickel titanium files that we use to shape and clean the canal. This is a space-age alloy that is used for dental instruments that allows them to bend and then maintain their shape without breaking. It's just an amazing, amazing thing. So nickel titanium files we use for cleaning the canals. And then we also utilize, obviously, newer medications, the most modern antibiotics and disinfectants to cleanse the canals. There's also a laser that can be used to sterilize the canals, which we also have.
Okay. And after the root canal, do you always cap the tooth or use a filling, or what do you do?
Great question. This is a very good question. Unfortunately, we still see a lot of patients come to us that have had root canal treatments done years ago or at another practice where the root canal treatment was done, especially on the back tooth, on the molar, say, and they just placed a large filling into the opening and let the patient go. What happens to these teeth is very often they break. They break, they crack, the patient will then even might end up losing the tooth, which is a very sad thing because they just spend a lot of time and spend some money on fixing that tooth, and the tooth in the end breaks and they have to lose it. We do not allow that to happen to my patients. So every back tooth, molars, premolars, definitely gets a crown after a root canal treatment. There's no question about it. A crown is the way to safely cover and protect the tooth after a root canal treatment and not allow it to break. In the front, the situation may be different. If the damage to the coronal part of the tooth is minor, a lot of times we can fill the access cavity and not have to crown the tooth. But what happens over time is sometimes root canal teeth discolor. So in the front of the mouth, cosmetics and aesthetics become an issue. If the tooth is starting to turn gray or dark, then we can always go back and crown it and make it look pretty again.
All right, and what are some of the benefits of getting a root canal treatment versus just ignoring your problem?
When you have a situation that requires a root canal treatment, you literally have 3 choices. You can have a root canal treatment and extend the life of the tooth or save the tooth. You can extract the tooth, and that's also a definitive way of dealing with problems that require root canal treatment, but you lose the tooth. And then you can do nothing. You can procrastinate. And usually the procrastination is the worst choice. Because what happens is you have this reservoir inside the canal, inside the tooth, filled with bacteria, biofilm, with their byproducts. They're constantly producing toxins. They're constantly attacking your immune system. And people sometimes don't even realize, but all these bacteria and their byproducts that are leaking into your bloodstream from those untreated root canals can cause organ damage over time. They can cause abscesses. They can lead to swellings and severe infections. They can sometimes even be life-threatening. So ignoring is never a good idea. A root canal treatment, when indicated, is a great way to save a tooth. Extraction is not such a good choice, but it's better than doing nothing.
Okay, great. Well, thank you so much, Dr. Kaplansky. We know you're extremely busy, so I just want to thank you for your time and help.
Thank you, Liz. It's always a pleasure talking to you.
And for our listeners across the country, if you are interested in speaking with Dr. Igor Kaplansky, you can either go online to www.drkaplansky.com or call 716-772-7500 to schedule an appointment. And on behalf of our entire team at RazorCast, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading industry professionals.
You've been listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.